Good morning, or I guess it's sort of afternoon. Anyway, hi, I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible, 7 Keys to Defy the Odds. And today I want to talk about traumatic brain injury or head injuries in general. There's been a lot of science coming out in recent years about how significant it is when you have even quote unquote a minor head injury that can last you years and years of trauma in your body and in your brain. And Dr. Daniel Amen was the psychiatrist who, starting in the early 1990s, started scanning people's brains to see the extent of injury to the brain, and especially with injuries like football and things like that. And he's the guy who did a study on football players to show just how much injury there was to their brains. And until we did these scans, they were called SPECT scans that looked at actual tissue damage to the brain that we could not see on basic MRIs or CT scans. And so even a minor, what you would call a concussion, has been considered to be bad for your brain. In Chinese medicine, it is also considered not healthy to have a head injury. And I want to tell you about it because it is so fairly simple to fix with acupuncture. So, at least in the style of acupuncture that I do. So, one of the things that is an indicator of injury to your head or brain is if you are tender at the top of your head up here. So, there's several points that you could test, but just a light touch where it's tender to touch. That means that there is some effect in your body that is being caused by head injury. And that can be treated with certain acupuncture treatments. And I'll tell you a little story about a patient of mine who was 58 years old when she first came in. And when she was 7, she was hit by a car and had injuries from that. And her head was injured and she had a concussion. I think she was knocked unconscious. And ever since then, she's had a headache every day and has had total body pain and many other conditions in relation to that. And when she first came into me, she had not had a day that was without headache for years. And within the first treatment, she had 2 days of pain relief from her head because I found the head trauma point on the top of her scalp here, and treating it helped her headache go away. So several things I want to say. One is that if you get the right treatment, an injury doesn't stop you. So if you have the right treatment and you get relief of that trauma, then your body will be able to heal from it. And head trauma is one of the things that can easily be healed if treated correctly, depending on how bad it is, of course. Now, there are other things that help with head trauma as well, not just acupuncture, but acupuncture is so effective. Like for this woman, it was years after her head injury, and I was able to make a difference just by doing a few acupuncture treatments that helped resolve her head pain. Now, there are also supplements that you can take and other treatments that you can do. There's a story of a young man who was hit by a car and severely injured, and he was in a coma for 3 months and treated with progesterone and IV omega-3 fatty acids. Now, some hospitals are now doing this, but progesterone is not just a hormone that helps your hormones, in general, but it also is a neurotransmitter, and it helps your brain, and it helps keep your brain healthy. And so for this young man, when he got a high dose progesterone, it helped restore his brain function. And it is actually how, for a lot of women, as they go through perimenopause, they start to have symptoms of brain fog and difficulty thinking, and the progesterone can help not just with sleep, which it does help, but it can also help calm the nervous system and help relax and help the brain function better. Also, omega-3 fatty acids, especially the component of omega-3s that is called DHA, and that is dihydro something, I forgot. Anyway, DHA, which is an omega-3 fatty acid, and it comes from either fish oil or algae. So you can be a vegan and still take this, but you have to be careful which type you get. When you get fish oil, I always recommend that you be careful, that the oil has been filtered properly and doesn't carry mercury or radiation, or other toxins. So you want to get a certified, sort of super clean omega-3 fatty acid. And when you have a head trauma or brain problems, high dose omega-3 is very, very helpful. And the sooner after the injury you get it, the better it is. This is also true with the progesterone if you get it fairly soon after the injury. And even in children, I have one young 16-year-old who was several head injuries during gym. She was hit in the head a number of times with some of the exercise programs she was doing. And I gave her high-dose omegas and some progesterone and acupuncture and craniosacral work, which is something I'll address in just a second. But all of that within a couple of weeks or 3 or 4 weeks of her injury was able to help her resolve her symptoms of the head injury, and she was able to function better and focus better and think better. You want to treat head injuries or brain trauma as soon as you possibly can. But as I said, for the woman who was 58 and had a head trauma when she was 7, it made a huge difference just doing it many years later as well. So I just want to say that. And okay, there was one other thing I wanted to tell you. Progesterone, omegas, acupuncture, and craniosacral work. So craniosacral work is a very gentle, hands-on treatment of the bones of your skull. And when there is injury to your head, or even if there isn't an injury to your head, the bones of your skull are supposed to move a certain way. And actually, they don't have big movements, or we would look very, very funny, but there's a very subtle movement of the bones of your skull. And when they are moving properly, then the fluids in your nervous system are also moving better, and then they're circulating through your body and providing the input that your body needs in order to function well. So craniosacral work is this very gentle holding of your head to feel the movement of the bones in your skull, and then to gently adjust them into functioning and moving smoothly. And I always love craniosacral work because it's, one, very relaxing and peaceful, but also because it's so subtle. And like when I hold somebody's head, the movement of the bones of the skull is sort of like the movement of the ocean when it comes in and out. So it's like this very gentle movement. And I'm moving my hands obviously much more than you would feel if I were doing this to you. But it's a very gentle movement, and you can feel it coming in and then going out. It's not the same as the movement of your breath. So when you're breathing in and out, that's one type of movement of your body and functioning of your bodily functions. But the craniosacral movement, or the movement of the bones of your skull, is more associated with something else. And it has been studied in various places to figure out what is the source of this. And it is really very much like the movement of the waves of the ocean when they come in and go out, and hopefully not like a stormy ocean. Anyway, I hope you found that helpful. And if you have any questions, please feel free to contact me at hearttoheartmedicalcenter.com or call my office 707-524-9640. I look forward to hearing from you, and I hope that if you have any even minor head injuries, that you get the proper care, because it can make so much difference in how you feel in your body. Thank you so much. Have a wonderful day.